Hi everyone, this is Dr. Gopal Krishna Purohit, CEO at Heredity Biosciences. Today, on the occasion of World Hemophilia Day, I would like to educate you all about this disease called hemophilia. World Hemophilia Day is observed globally on 17th April every year. In this day, people observe to raise awareness of hemophilia and other bleeding disorders. The day was chosen in honor of this World Federation of Haemophilia founder Frank Scannell's birthday. Since then, the day is observed to bring people suffering from hemophilia and other bleeding disorders together. So, what is hemophilia? It is a rare disorder in which your blood doesn't clot normally because it lacks sufficient blood clotting proteins or factors. If you have a hemophilia, you may bleed for a longer times after an injury than you would if you blood clot normally. Small cuts usually are not much of a problem. If you have a severe form of the conditions, the main concern is bleeding inside your body, especially in your knees, ankles, and elbows. Internal bleeding can damage your organs and tissues and be life-threatening. Hemophilia is almost always a genetic disorder. There are two major types of hemophilia, type A and type B. Both A and B can be. If it is a mild, approximately 25% of cases are found in mild. If a person with a mild hemophilia has factor levels of around 6 to 30%. In moderate cases, approximately 50% of cases is moderate, and a person with a moderate hemophilia will have factors levels of around 1 to 5%. In severe cases, approximately 60% of cases are severe, and people with a severe hemophilia will have factors levels less than around 1%. Hemophilia A occurs due to the lack of clotting factors 8. This type of hemophilia is 4 times more common than hemophilia B. More than half of the people with hemophilia A have a severe forms. If the hemophilia B is other than what is known as a Christmas disease, happens due to the lack of clotting factors 9, hemophilia B occur in around 1 in every 25,000 males born in worldwide. Then, what are the symptoms of hemophilia? Flossing, hematomas, bleeding from the mouth and gums, bleeding after circumcisions, blood in the stools, blood in the urine, nose blotches that are frequent and difficult to stop, bleeding after vaccinations or other injections, bleeding into the joints. What are the treatment for hemophilia? Although no cure exists for hemophilia, healthcare provider or doctors can successfully treat the conditions. Treatment focus on replacing the missing protein and preventing complications. It involves gives or replacing the clotting factors that are too low or missing. Scientists can derive clotting factor transfer treatments for replacing therapy from human blood or synthetically produced from a laboratory. Synthetically produced factors are called recombinant clotting factors. Doctors often consider recombinant clotting factors as their first treatment choice because they further reduce the risk of transmitting infections that can be present in human blood. However, modern screening techniques have decreased the likelihood of disease transmission from human samples. There are two main forms of replacement therapy. First one, prophylactic therapy. Second one, demand therapy. So some patients will need regular replacement therapy in order to prevent bleeding. This is called prophylactic therapy. Doctors typically recommended regular treatment for people with a severe form of hemophilia A. In the demand therapy, this will stop the bleeding on demand. People living with a mild hemophilia may only need demand therapies. This is a treatment the doctor provides only after bleeding begin and remains uncontrollable. There are some complications in the treatment procedure in hemophilia. They can include developing antibodies to treatments and viral infections from human clotting factors. Treatments can also cause blood clots. Getting treatment as soon as possible is important to help reduce the risk of damage to joints, muscles, and other body parts. This is all about hemophilia disease. Thank you for listening. Stay safe and stay healthy. World Hemophilia Day. Thank you.